Hi, I'm Dr. Michael Cronin, and I'm here to update the audience on our fundraising campaign for raising the funds necessary to save patient access to essential compounded medications. This has been a 3-year effort by the American Association of Naturopathic Physicians and the associations involved with the Integrative Medicine Coalition. We have been giving testimony in the FDA process on saving our essential natural medicine-based compounded medicines. It's been a 3-year process, and we've had a lot of talent involved with it, and I wanted to announce that we've had some successes in terms of saving DMPS, which is used in chelation medicine, methylcobalamin, serotonin, and 5-HTP. These are really essential nutrients that will continue to be available for patients to be applied and prescribed by doctors. We have a big one coming up with glutathione, and it's really essential that we keep our defenses high and our offenses and testimony strong. So we are asking for your continuing support. Please, if you've given before, try to give again. This is for both patients who have received the benefits and the doctors who get the privilege of treating these patients who need these medications. We've learned a lot along the way. Dr. Paul Anderson and the compounding pharmacy groups, we've been working as an effective coalition, and we are confident through our vigilance that we'll be able to protect the liberty to have access to high quality nutritional compounded medications. So thank you for listening, and please enjoy Dr. Anderson's update.
So with respect to the update around the FDA PCAC hearings for 503A pharmacy compounding, we are recording this in July 2021. We just completed the last hearing with the FDA PCAC, and that is the one that many of you heard, that things such as methyl B12, melatonin, 5-HTP were approved for pharmacy compounding in the 503A class pharmacy. Things such as choline chloride were declined, so unable to use them in pharmacy compounding. And in the past, we have had things such as really good wins, DMPS, the chelator, being approved, but many, many things being declined. The process now is moving forward, and we have just a few items left on the list that is waiting for a new hearing. We don't know when these hearings occur. We usually get about 4 weeks notice, and we have to prepare ahead. Right now, the most important, in my mind, substance we're preparing for is glutathione. Glutathione is used in almost everybody's practice in a number of different delivery forms for a number of different reasons, and we are at this time working with experts in glutathione pharmacology on building a case to keep glutathione accessible through 503A compounding. If it gets declined, it will be like the other items declined, and you will no longer be able to order glutathione in any form from a compounding pharmacy. This obviously would affect practices everywhere. So our purpose now is to continue to use the resources that we have, that Dr. Cronin talked about, continue to use many, many people who are donating their time and effort, and build the best case we can for the remaining substances. And I'm highlighting glutathione because it's so important to all of us. So I would really ask that you follow what we're doing here. We're going to have a link to a location you can make comment directly to the FDA, and we'll give you glutathione and the other items you can make comment on. And in the past, what we have noticed is the process with these hearings is never the same hearing to hearing. They change the rules. So we're learning as we go along. We're improving our tactics, and we believe that by the time we get to the last hearing or 2 hearings, we'll be able to effectively defend glutathione. What FDA does with the information is up to them. So please keep track. Look at the link that we're going to provide for making comment to the FDA. And if you and or your patients can, please donate.